Truveta's an interesting play. So this is essentially a massive data store, about, I don't know, 10 or so health systems coming together. And they're not small health systems either. I mean, it's Providence, it's Trinity, it's some very large health systems coming together in big data stores. And they're essentially going to anonymize the data and monetize it. Anonymize and monetize.
You should be in marketing.
Wow, that's hard to say, but that's what they're going to do. And obviously the whole thing's couched under for the good of humanity and for the good of mankind. But the reality is that's in this same vein of we're going to take all this data. But let me ask you this with regard to this.
Yeah.
What do we have to do to clean up the data? You had to clean up some of the data. What do we have to do to clean it up to be ready for AI? I mean, is there a path for this?
No, I don't think there is. I don't think there is, honestly. I mean, I actually I'm happy to, I think it's still up on the Wellpepper website, but I wrote a number of blog posts on this, one in particular called Garbage In, Garbage Out. And it's not so much that, I don't want to insult people and say that everything in the EMR is garbage, but we know that it's not consistent. We know that it hasn't been consistent over time. And a lot of the information is in the notes. And, I just anecdotally read a pretty interesting Twitter thread of a doctor who was talking about the terrible notes that the previous physician had put in, and she couldn't follow them, and they were too wordy and they weren't getting to the point. And then she read it, she realized it was her. So I think that's a lot of the challenge. I'm actually a big fan of small data instead of big data, because the smaller the data, the easier it is to actually interpret what's going on. And that's, at Wellpepper, we had patient care plans that we had defined. And so when the data came back from those care plans, we knew what the patient was doing and we knew what we had asked them to do. And it made it much easier to actually, apply machine learning to see, for example, is somebody at risk of dropping off their care plan? So I would like to see less here's all of our data, and more focused, and perhaps even more thought about, how much data is healthcare generating every single day? Are there ways that we can just make the ingest of that better, rather than going back and trying to, just look at absolutely everything that's been created?